Good day, everyone. Welcome back to our YouTube channel. I still remain Adebite Olushola. Please, if you are yet to subscribe to our YouTube channel, please do so by clicking on the subscribe button as well as the notification bell, so you'll be notified whenever we post a new video. So today, I would like to talk about a condition also known as indicator for some health problem, which is known as hypoglycemia. Hypoglycemia is a condition in which your blood sugar level, that is the glucose level in your blood, is lower than the standard range. Yes, there is a standard range for the sugar level in the blood. So when it gets too high, it is known as hypoglycemia, also known as what? Diabetes. But when it gets too low, it is also a condition. It is known as hypoglycemia. So we need to understand that this thing has to be on a normal range, on a standard range. So but when your sugar level is lower than the normal range, the standard range, then it is known as hypoglycemia. So like we all know, or if you don't know, that glucose is essential. Glucose is the main source of energy for the body system to carry out its day-to-day activity. So I would like to talk about the signs and symptoms and also the causes and in ways in which we can prevent this condition. I need you to understand that hypoglycemia is associated with this condition, diabetes. Yes, so those diabetic patients are prone to have this condition, hypoglycemia. Why? Because if there is no proper management of the diabetes, if there is no proper management of their condition, it will drop their sugar level and it will lead to this condition. So hypoglycemia is associated with diabetes known as hyperglycemia. Yes. So what are the signs and symptoms of this condition? Number one, we have weakness. Weakness in the sense that because the sugar level, the glucose level is weak, your energy might be weak and all your body system tends to be weakened. So weakness, we have dizziness, we have falls. Falls can result as a result of weakness or dizziness. We have sweating. We have tingling or numbness of the lip, tongue, and the cheek. When there is numbness on the cheek, on the tongue, and on the lips, it's a sign of this condition. And also we have irregular or fast heartbeat. When you're having palpitation, your heart is beating fast, and you are having an irregular heartbeat, then it is a sign of this condition. Also hunger. Hunger is a sign of hypoglycemia, as well as nausea, that is the feeling or the urge to vomit. Then we also have headache. It is very common. So headache, we also have sweating, we have looking pale. When you look pale as if you have low blood in your body system, it is a sign of this condition known as hypoglycemia. Then untreated or severe of this condition, hypoglycemia, can lead to seizure. So severe of this condition, if not treated as well, can lead to this condition known as hypoglycemia. Also, blood vision is a sign of hypoglycemia. Now, what are the causes of this condition, hypoglycemia? With the causes, we can then find out the preventions. So we have medications. Yes, if you probably or mistakenly use medications of a diabetic patient, your blood sugar tends to low. Why? Because the medication is meant to lower their own blood sugar level, and because it is high already. But you mistakenly using someone's drug, a diabetic patient drug, your blood sugar tends to tends to drop. It tends to low. And also for the diabetic patient, when they are not doing they are not following the proper management of this treatment or their treatment. I mean the diabetic patient, when they are not following the proper treatment, it can also drop their low sugar level, in the sense that they have been taking drugs, they have been on medication, but they are not going for checkup. They are not going for tests to be sure that this sugar level is on the normal range. But if they are not doing this, they might not be able to know when to stop the drug, the diabetes drug, when to stop this drug, and then it will reduce the sugar level leading to this condition. Another cause is excessive alcohol intake. I need to tell you today that excessive alcohol drinking leads to hypoglycemia. Ask me how. Why? Because if you are fond of taking alcohol, especially first thing in the morning before eating, the alcohol tends to block the liver from doing its proper function, in the sense that the liver, the main function, one of the functions of the liver is to store glucose, store sugar as glycogen, so that whenever you are starving yourself, or whenever there is no food in your body system, there will be release of this glucose into the bloodstream, thereby giving you energy. I said earlier that glucose is the main source of energy in the body system. And also, one of the causes of this condition is some critical illnesses. Some critical illnesses, like I said, don't forget, like I said, that this condition, hypoglycemia, can be an indicator of some health condition, of some health problem. So, some critical illnesses like hepatitis, that is the inflammation of the liver. When there is inflammation of the liver will not be able to function properly. It will not be able to store glucose properly, thereby dropping the sugar level. So when you have not eaten, there will not be glucose left in the body to sustain you till when you are eating. So that's as a result of the liver damage, the inflamed liver. So the liver will not be able to function properly. So that's one of the causes of this condition. Another cause of this condition is long-term starvation, especially for those that are fasting. Your blood sugar level can drop before you take your meal, be it breakfast or lunch. Before you take your breakfast, maybe it is going to already afternoon period or evening period. Your sugar level tends to drop at this moment, although the liver is functioning by releasing the sugar, releasing the stored glycogen into the bloodstream. So another cause is insulin overproduction. Insulin overproduction. When there is overproduction of this hormone known as insulin is being secreted by pancreas. Insulin is an hormone that helps regulate the blood sugar level in the body. So when there is overproduction of this insulin, it tends to drop the sugar level in the bloodstream, thereby leading to this condition, hypoglycemia. Then, what are the pre-treatment and the prevention of this condition, hypoglycemia? The treatment varies. One of the treatment is like treating the underlying causes. Like if the cause is based on, for example, the clinical and the critical illnesses is as a result of some critical illnesses, those illnesses has to be treated first. For example, if it is being as a result of hepatitis that inflamed liver, you need to treat the liver first before further treatment. So, as a result of underlying, and also it could be immediate initial treatment to increase the sugar level, to raise the sugar level. And this applies to those that have early symptoms of this condition, hypoglycemia. So when you have early symptoms of this hypoglycemia, they might advise you to take some fast-acting carbohydrates. What do we mean by fast-acting carbohydrates? Fast-acting carbohydrates are those type of carbohydrates that you take that can easily be converted into sugar and can easily be absorbed to the bloodstream and can easily be absorbed by the body. An example of fast-acting carbohydrates like candies, like sweets, like soft drinks, like glucose candies and all that, glucose tablets and so on like that, or gel. So all these can help improve for those that have early symptoms. It can help increase the sugar level in the body so fast. And whenever you are on this fast-acting carbohydrates, fats and proteins are not meant to be taken at this period. Why? Because fat and protein slows the absorption of sugar in the body. So it slows the absorption. So it will not make it fast. So, like I said, that now for those that are diabetic, the diabetic patient, you need to follow your diabetes management plan that you have planned or you have developed with your doctor. You need to follow it. Be it you need to change your drugs, be it you need to change your schedules, your diet, your exercise. You and your doctor have to plan and develop these things. And that could be as a result of probably you have been going for regular checkup, you have been going for regular treatment to see your doctor, and by then they will be able to know if there is changes or not. So you have to follow your diabetes management treatment given to you by your doctor, or that you and your doctor have planned. So you should not go outside of that. And so that your blood sugar level will not drop without you knowing. And for those that are not diabetic, like I said earlier, that you can just take some fast-acting carbohydrates that can help increase this sugar level. Okay, so now what are the ways in which you can prevent this condition? For those that are taking alcohol first thing in the morning, it is very wrong. It will damage your liver. It will block your liver from storing glucose. Yes. So, and for those of you that are always fond of taking some people's medications, you don't know what it entails, what it contains, but you just see it and it looks okay. It is wrong. Don't take other people's medication. And also, if you are on medication, please keep medications out of reach of all children, so that they will not use this medication without you knowing. So, and also, if you are on long-term starvation, or you are on fasting, you ensure that you eat at the adequate time, or you eat at the right time when you are meant to, so that the glucose level will not get too low for you to be able to carry out a daily activity. That is, your energy will not be that so low. So you need to eat at the right time. So thank you. I hope I've been able to pass a lot of messages across. Thank you and have a lovely day.